Whenever a client or a new client comes into the clinic, we have them fill out a client information sheet and go over the pet's information so that we know its medical problems and if it is on heartworm or flea preventative, as long with if it's neutered and how old it is and the birthday and the breed. At this clinic, we are using a paperless practice, so everything is either scanned in if it's on paper, and then it's all electronically in here. So you can go back to the different types of vaccines and it will pull up any other records or any surgeries that we have done on the specific animal. So this client came in for her dog to be neutered, and so you would fill out the consent form if you wanted blood work, or if you declined it, we have the pre-surgical profile and the CBC and the comprehensive CBC, which would go over your liver, kidney, and pancreatic functions, along with your blood sugar, cholesterol, and immune status. They can decline it or they can pick whichever one depending on how healthy or how old the patient is. And then the pain medication, if they would like post-op pain medication, we recommend that they do. And if their pet is microchipped, we also have that if they want to request it or they decline it, or if their animal has already been microchipped, and then they sign them. For every patient that comes in the clinic, we put a cage card that would go on the cage. It has the owner's name and the phone number, the animal's name and its ID number, so that when we take x-rays or have other filing systems, we use that number. It goes over the breed and the color in case we have multiple animals that come in that are the same color. That it will also go over if they're neutered, spayed, or still intact. It goes over their age and their weight, and if they have any allergies, it would pop up here. And then instructions would be as to why they're here, such as this animal is here for a neuter. For during every surgery, we have these traveler sheets that go over which spay and neuter, if the cat's being declawed, or if there's just another general surgery that we're doing, or a dental, and it goes over the different induction agents so we can have it recorded and also scanned into the patient's file. And it goes over the different pain medications and the suture and glue that are used, and if any pain meds are going home, and the different types of fluids if we have to put the animal on an IV catheter. And it also goes over how much isoflurane or Domitor that has been used. Whenever an animal goes home after surgery, we send home a home care instruction sheet, and it goes over how much food and water should be offered, such that you should reduce the diet by 20% the first night. And sometimes that they won't be back to normal that night, that it may take a few days for them to be back to normal activity. And then also a lot of things that can happen, such as the animal can chew open the surgical site, and so we try to warn people that their animals may start licking excessively at the area, and if so, to call us and we can send home a cone, or if there's anything else that could help. Also, there may be swelling or redness that can be from a suture reaction in the animal. And so on the pain meds, we send home different ones that are given twice a day. A lot of them can cause GI upsets, such as diarrhea or not wanting to eat or blood in the stool. And so we try to warn them if that happens to stop immediately and call us, and we can switch the pain meds or try something different. When pulling a jugular, you want to make sure you remove all collars or bandanas or anything or leashes around their neck so that you have access to the whole neck. You want to make sure that you have the head up and angled slightly depending on if you're going for the right side or the left side of the jugular. And then you want to make sure they're as still as possible. And then when you're feeling for it, you want to you can shave for it and press down, and you'll be able to see the vein pop. When pulling a cephalic vein, you want to make sure that you have the skin good and tight and pulled back so that the vein doesn't move, and then you can feel for the vein and when you insert the needle. When going for the saphenous vein, you want to make sure that the animal is in lateral recumbency, and depending on which species of animal, you'll do the outside or the inside of the leg for the back leg. And you'll want to hold the skin tight, and you'll be able, when you pour alcohol, to see the vein running up and down the leg. Whenever getting an animal out of a cage, it's good to make sure that you have control over them. So you want to just make sure that you have them against your body and scruffing them so that you have full control of the animal. And then when putting the animal back in, you want to make sure that their head is facing away from you so that they come back at you and you're still scruffing them or holding onto their neck. And when you're ready to let go, they're safely away from your at arm's distance. When placing a muzzle in a safe manner, you want to make sure that you're behind the animal and that you have the muzzle already loosened up so that you can tighten it. You're not having to tighten it while wrestling the animal. And you want to go behind them and straight back up. And so you have control, and you want to tighten it so that it is tight around and that you have full control of the animal. Whenever measuring for an e-collar, you want to make sure that you measure around the neck so you don't have it too tight or too loose. And you can always use rolled gauze or stretch gauze to tie it, or you can use it through the collar of the animal, but you want to make sure that it is tight and around the head so that, and it's past their nose so they can't scratch or lick or chew at what you're trying to create them from doing. Okay, whenever you want to do a physical exam, you want to get the TPR, which stands for temperature, pulse, and respiration rate. So I'm getting the temperature right now, doing it rectally. And his temperature is 102.5, which is elevated because he is nervous being up here. When searching for the pulse and feeling for it, it's going to be in the top of your dog's hind leg, and you'll feel for it, and you'll count it for 15 seconds and times it by 4 to get it by the minute. And so his is about 100. And then when getting a respiration rate, you want to watch when he breathes. You want to make sure his mouth is closed so he's not breathing too fast. And you do the same thing. You count it for 15 seconds and times it by 4 to get it per minute. Alright, and when listening to their heart during the examination, you want to make sure that you're examining all 4 chambers. And while listening to the heart, you may hear murmurs, and depending on which grade it is, and also which chamber it's located in, and that can lead to other diagnoses as well. And you also want to make sure that you listen to the lungs to make sure there's no fluid in them or in the airway. And I would assign this patient an ASA grade of the class 1 with minimal signs of disease. When doing a physical exam on a cat, you want to make sure you get the TPR. And his temperature is at 99.2, which is a normal range. And then when checking the pulse, will be in the hind leg at the femoral artery next to the groin area. And you'll want to count for 15, or do it for 15 seconds and times it by 4 for your minute. and his is approximately 140. And then you'll also want to make sure you get the respiration rate, and do that as well for 15 seconds, and then times it by 4. And when listening to the heart, you want to make sure you do all 4 chambers. It can become difficult in cats when they start purring. And the same as dogs, that whenever listening to their heart, you can listen for heart murmurs. And then you also want to make sure that you listen to the lungs. And listen for any fluid that could be in the lungs that would be an abnormality. And his ASA grade would be a class 1. Okay, stop the video. Okay, stop.
I stopped.
Did you see the blood in the syringe?
Mm-hmm.
Okay, that's all I need. Thank you.
Oh, no, I didn't.
Okay, stop. Okay. The minimum databases for surgical healthy candidates you would want to search for the PCV, and that is the packed cell volume. And if it is low with decrease, it can be renal failure, or it can also lead to gastric ulcers or blood loss depending on the PCV. And for canines, the normal would be the 37 to 54%, and in felines it's 27 to 48%. Okay, and also you want to look for the TP, which is the total protein, which is the animal's plasma protein levels within their blood, and that can show malignant or infections or dehydration. And the blood glucose is the metabolism, the carbohydrate, and it can increase in cats if they are stressed out, but it can also show if animals are diabetic. The blood urea nitrogen, which is the BUN, the levels are used to evaluate the kidney's ability to remove the nitrogenous waste from the blood, which will indicate whether the kidneys are working properly or not, and if they are going into kidney failure. The ALT is an enzyme found in the livers of dogs, cats, and primates, and it can be increased with different drugs, and so most of it is just a general guideline. Sometimes animals come in that are geriatric or sick, and so you would want to run a more panel that does more bases, such as albumin, total phosphorus, total bilirubin, and creatinine. And if an animal comes in that may be injured, you may want to take some x-rays as well of that. Good anesthetic and a post-anesthetic protocol would be such as if a canine came in that was here for a spay or neuter, we would give them a hydromorphone 30 minutes prior to the surgery, giving it IM, and whenever they're in for being inducted, it would be for midazolam and ketamine. And after the trach tube has been removed, and the animal is in the cage, we can give them Domitor IV. For when an animal comes in that we have to use a controlled drug on, they have to be recorded in the computer, such as this one was given butorphanol IV along with Domitor. And so the net change will change, and it shows the balance that we have selected in inventory for every controlled drug that is used every day. This is our anesthesia machine, and as you can see, the oxygen tank is hooked up through here, and since we don't have big enough room for a closet, it's chained up in the corner of the room. This is the pressure reducer valve. This is the valve that when the oxygen is leaving it, so it's not too much PSI, it regulates it, and we have it set on. This is the flow meter, and it allows we can decide how much oxygen the patient is able to have depending on the breed and the size of the patient. This is our vaporizer. The gas that we use is isoflurane, and it regulates, and the function is to allow so much ISO to see how deep we want the patient to be during the anesthesia. If they're too light, we can turn it up, or if they get too deep, we can always turn it off or just lower. Whenever air is being moved through the tubes, it comes back through the inspiration valve and the expiration valve, depending on if the animal is inhaling or exhaling. So when they're inhaling, they're sucking the air in the tube into their body, and then it's expirating outside the tube but within the inside of the tubing itself, the external tubing. And these flutters will move whenever the animal is breathing, so you know that they are breathing correctly. This is the negative pressure valve. Whenever an animal, if you have to breathe for it, or whenever they're breathing on their own, it tells you how much pressure they are breathing, and you never want to go over 20 if you have to breathe for the animal or performing CPR, because you can burst the lungs. This is the rebreather bag, and so depending on the size of the animal or the size of the lungs, depends on the size of liter that bag we choose for them, such as this would be a cat and this would be a larger dog. When using a rebreathing anesthesia circuit, it's some of the benefits or some of the reasons why people use them would be that they recirculate some of the anesthesia gases, and that you can have a lower flow of oxygen since some of the gases are being reused. And it also and when using a non-rebreather circuit, the benefits of that is they have a low resistance for breathing because they're breathing in fresh air, and they get fresh air every breath using the trach tube, so that they're not reusing the same gases over. And some of the different type of induction chambers that are used, such as the box for if you have a feral cat that you can't get a hold of or can't induct the agent using a net, you can get them in a smaller container and run ISO through. It is a lot slower of a process when trying to induce them, but it does work. There's also another induction type that you can use, which would be mask. So if you're able to contain the animal or need a little bit more boost, some doctors like to use the mask that allows you to put it around their muzzle and do so they breathe in the ISO, but it isn't directly into their trach tube and straight into their lungs. On the first step of doing a leak test, you want to make sure that your anesthesia machine is hooked up to your oxygen and that your oxygen is turned on. And so you want to attach the circuit that's going to be used. Check your vaporizer that there's enough anesthesia in it for it to be used, and then on this end you'll put it against your hand. So you have the end against your hand, and then you close the pop-up valve, and then you hit the flush valve, and you have the pressure read to 40. And then you watch this, and if there is a leak, it will go down. And then after you move your hand, you check the system for any leaks or connections to make sure they're all still intact, and then you open the pop valve back up. Okay. The pulse ox is used to, has the ability to evaluate how much blood is in the bloodstream, and it also can monitor the pulse rates. It measures on how much hemoglobin is available within the saturated within the oxygen. So whenever you use it, it has a red light and an infrared light, and it uses those to determine how much oxygen, or the level of oxygen within the blood, and if it's within a normal range. This is the esophageal stethoscope, and it's a less invasive way to measure the heart rate. And so you pass it through the mouth and down the esophagus, and when it's next to the heart, you will be able to hear the heart rate. And this is the EKG. It also monitors heart rate, and you clip it to the different parts of the leg in order to, when the blood is pumped, it also will tell you what the heart rate is of the animal. When picking out a trach tube, the trach tube is normally picked out by the size of the dog or the weight, and some through experience have been able to palpate the trachea to know the size, and normally typically do a half size higher and lower as well, so you have it readily at hand when needed. When doing a trach tube leak test, you submerge the trach tube in water, and then you get a syringe and inflate the cuff, and you check for bubbles. If there's any bubbles, then you would throw the trach tube away, because then it would be faulty and wouldn't be doing its job. The blood pressure monitor is used to test the blood pressure of a patient, and so we use the cuff, and so you would wrap it around the hind leg, wherever you would do it using a different machine. And so you would do it around there, tape it, and then start it, and it would fill up with air, and it would get the blood pressure that way. Whenever an animal is under anesthesia, you want to make sure that their temperature doesn't drop too low. The longer they are in anesthesia, they are more susceptible to having a low body temperature. So you would insert this into the esophagus, since the trach tube would be occupying the trachea. And so you would insert it down, and then it would give you the reading on the screen of the temperature of the patient, so you can do what is needed for depending on the temperature.
Hi, I'm Johanna Armstrong. I'm co-workers for the Angela Blankenship, and I have been helping her doing the videos for her projects.
When prepping for an IV catheter, you want to make sure that you have all the tools available and all the equipment so that it's readily at hand. When clipping, you want to make sure that you clip in a pair that when the catheter lays flat against the body, that it doesn't touch any hair, so it's better to shave more hair than not enough. Okay. And then you want to make sure that you get all the loose hair from off the body. When prepping for the IV catheter, you want to use the alcohol and a cotton swab. So you want to start in the middle and go in a circular motion towards the hair margin, and you never, once the cotton ball leaves the center, you never want to go back across to the center for contamination. When opening the catheter, you want to take off the tip on the top and then the plug on the bottom. When placing the catheter, you want to make sure that the same hand is holding the vein parallel along with the leg extension to make the vein easier to get into. So you want to have the catheter at a 10 to 20 degree angle and insert it into the vein. Then you'll be looking for a flashback within to know if you can continue onward or not, if you've gone through the vein. When taping a catheter, you want to start with the underneath and go around to secure the catheter and place it.
Record.
Okay. And then you'll want to tighten the IV line to ensure that the catheter is placed. When taking the catheter out, you want to make sure that you don't pull it out all at once. And so you pull it out, hold it off, and apply bandage for a little bit so that it can heal on its own. When shaving for an IV catheter placement, you want to make sure that you have all your tools readily at hand. And so when you shave, you want to make sure that you shave enough area so that when the catheter is being placed, you have enough room to where the catheter doesn't touch any loose hair or cause for any contaminants. So you want to make sure that you have all the loose hair from off the site where that you're going to place the catheter, and same as before, when cleaning with the cotton ball, you want to start in a circular motion and at least do it 3 times. And then once you leave the center, you never want to go back over the center. When opening a catheter, you want to make sure that you take off the plastic safety tip and the stopper on the back. When placing the catheter, you want to make sure that you stabilize because this vein moves around a lot, so you want to make sure that you have it stabilized with the same hand that's extending the leg. And go at a 10 to 20 degree angle, and you want to look for the flashback so you know you can continue as long as the flashback is coming. When taping, you go underneath the catheter and then go around to secure it. Secure the catheter. Okay, and then when you hook up the IV catheter, I'm going to remove the injection and ensure that the catheter is running. When removing the catheter, you want to make sure that you have the IV line off, otherwise you'll just spray out whenever you remove it from the leg. So you want to slowly remove the catheter from the leg and place Coflex around it or another type of tape. Some induction agents have to be given subcutaneous, intermuscular, or intravenous, so I'm going to demonstrate giving one sub-Q using saline. So you pull up the hair, make a tent, and inject it in. I'm also going to do it intramuscular using saline, so you want to make sure that you feel the muscle on the back and make sure you go straight back at a 90-degree angle into the intramuscular and inject it that way. Like that. Some induction agents are giving intravenously, such as this is propofol given.
Pretty girl.
they know about what stuff they need to autoclave for tomorrow?
Yes, I've already handed it all to Alyssa. Okay. When some animals go under anesthesia, their eyes can dry out, so you want to put ointment on the eye to help them so they don't dry out during surgery. Once the trach tube is in place, you want to make sure that you put air in the cup and inflate it. Otherwise, they can swallow still and they can choke and aspirate on their own saliva, or if they vomit, it helps prevent that. And so you want to make sure that you don't get it too tight, because then you can hurt the trachea, and you want to make sure that it's not too deflated to where it does no good. When clipping, you want to make sure that you clip enough area for the incision site and the surrounding areas. We are using chlorhexidine to scrub. We're using a solution and also a scrub as well. So you would fold the gauze in half and then in half again, keeping all four corners at once. And so you want to clean the area first and then put chlorhexidine, the scrub on, along with the solution as well. And you want to start in the middle and just clean the whole area at once. Using a forward and backward motion. What you can, if you did.
Keep going.
And then when you start at the middle, you want to start on the midline. And then when you make the circular pattern, you never want to cross back over the midline. And you want to do it at least 3 times. whenever performing CPR or if you ever have to using the bag, you want to make sure that the ISO is off and you only have the oxygen flowing. And so you want to close the valve and squeeze the bag, but never go over 20. And you can see the lungs inflate while you're bagging her. When scrubbing in, you want to make sure that you already have your mask on and your head hair. And so when scrubbing in, you want to start with the fingertips first. You want to do it 10 times across all the fingers. And then you want to start on the side. Go down your fingers and do the palm 10 times. And then when you come up, you want to make sure you have the fluid motion on the back. And then you want to scrub up your arm on each of these 4 10 times. Alright, when gloving or when putting a gown on, you open it from the out to make sure that the sterile is on the inside. You grab it from the top at the neck portion and put one arm through. The other arm through, and then you open the gloves here still as possible. And that is you gloved up. Make sure you remember to take off all your jewelry, pins, and name tags before beginning. Can't do this with gloves on. Okay, so in opening a pack, you want to make sure that you break the seals of the indicator tape and the tape as well. And then using the tabs, you only grab the outer edges to make sure that everything inside is still sterile. You'll want to lay out the packs to make it easier for the surgeon
You open up your gloves for
to
it.
get into. So you just want to lay everything out for him, such as this is a dog spay that's being performed. Okay, there's tissues that are exposed during surgery, and you'll want to have them moistened while they are being exposed. So they don't. And then putting on the scalpel blade.
questions? Thank you.
When being a sterile technician, you want to make sure that everyone follows the protocols of making sure everything stays sterile within the operating room that's supposed to stay sterile. Sometimes things happen and that doesn't always go according to plan, such as puncturing a hole in the glove, or if such as the surgeon drops a instrument on the floor, if the drape gets moved. And there are things such as like flash sterilization that only takes a few minutes if the surgeon needs that instrument within the same procedure that is being used. And within doing, if there's a puncture in the glove, you can always change out the gloves and to make sure that you don't contaminate any more of the area that was touched or accidentally touched. And when handing things over to the technician, you want to make sure that you don't touch anything, that within, your sterile limits, and so you don't touch something that shouldn't be touched. And then you open packages how they're supposed to by doing the flaps, and the surgeon will grab the So when cleaning after a operation, you want to make sure that you still have all the instruments. So we just start by putting them all back in the pack. And there are a few stray needles. So make sure everything is in the pack, and then we remove the needles that were used if they are dull. And we also remove the blade off of the scalpel handle. And we discard those in the sharps container across the room. And then we clean up the drape and make sure the surgical table is clean after the surgery. And then we start the cleaning process of the pack. When cleaning instruments, we fill up a pan in the sink full of water, and then we mix it with the pink liquid detergent. And we just add enough to turn the water pink a little bit, and then we empty the instruments. I like to open them up so if there's any blood in any of the crevice or the hinged areas, they have access to getting the warm water. And we let that sit for 10 minutes. And then when cleaning a pack, I like to get a brush and brush in between the hinges and along the other parts of it, just to make sure that you get all the debris and any skin or blood that is left from the surgery. And then after all the instruments have been scrubbed, we stick them in the ultrasonic for 10 minutes to be cleaned. And in there, they kind of vibrate within the pan itself. And once the instruments come out of the ultrasonic after they've been in there for 10 minutes, we lay them out here. And this is where I like to count to make sure all the instruments are within the pack by lining them up with their pairs.
Sorry.
up and pair it out. Then we spray it with a Spectra lube on all of the instruments as a thin coat and allow that to sit for 10 minutes, and then we flip and repeat the process of spraying it again. Alright, when wrapping a pack, you want to put the tray in the very middle, and then you use the bottom of the 4 flaps and you fold it up. Fold it up, and then you leave a flap out on top for you to use. And then you go on the sides and you turn in those flaps as well. Within the middle of it. And then using this last flap that is here, you do it on the inside, and it leaves within a flap there. And then you would use tape to tape it down, and you can write your initials of who wrote it, what's within it, and also the date that it is wrapped so they can use it. And then you use an indicator tape so that people know when it comes out of the autoclave if it's been sterilized. When folding a gown, you want to place it on its back and then straighten out the sides and the sleeves as well. And so you want to straighten it up and then fold in the arms. And then fold in the arms again, so that then you want to fold in the far edges to where they meet in the middle. You can pause it. And then you want to fold the bottom half up in half, and then the top fold down so it's folding into thirds. And then you would wrap it the same way that you would wrap the pack within itself. And so you start with the tab over, folding itself within, folding itself in half. Do this tab over, and with that, and then you do the same tapes, do the name, the date, and what is within the drape itself. And then you use the indicator tape so that when it heats up to the proper temperature, it'll turn black so you know that it has been properly autoclaved and is sterile. When using an autoclave, you fill it up with distilled water, and it fills up within a valve in the bottom of the autoclave itself, and it's heated electronically, and then the steam that is produced from the water is put into the chamber through a small port. And so that once the steam pressure has been reached and has been in the chamber at a certain temperature long enough, then everything within it would be sterilized. And once that whole cycle is complete, then the autoclave is finished. When packing an autoclave, you want to make sure that it's not packed too tight. So we only put one pack in at a time, because if you have too much packed in there, the steam can't reach everything, and so a lot of it doesn't get sterilized and the indicator strip won't turn. It may turn on the outside, but the indicator strip within the pack itself will not be fully turned on. So you want to make sure that you don't have it packed too tight within here. So about the average time for an autoclave to complete its cycle is about 15 minutes. And depending on what you have and how thick the item is, it may be sterilized between the 3 to 15 minute range. The typical temperature is 250 to 270, and the typical pressure is 15 to 27 pounds. So some autoclaves require a weekly and a maintenance autoclave. So the weekly would just be kind of cleaning it out and rinsing it out and wiping it and emptying it and filling it back up with distilled water. And then the monthly, that would be your more heavy duty cleaning. And that is where you empty the whole chamber, empty all the water, put whole new water in, and run a cleaning agent through it, so that you can clean out any excess water, any excess debris that has built up within, and making sure that the valves are secure so there's no leaking within the autoclave itself. And as you can see, this gown has not been autoclaved, but this one has, and you can tell by the indicator strip that it has reached its the temperature it's supposed to, and that is completely sterile and ready to use for surgery. When removing sutures, you want to make sure that the skin has been healed together from where they were being put in. And if the skin is still not put together or it's red and inflamed, sometimes the vet will want to keep the sutures in longer. Or if the animal has pulled them out and they've come in a few days later, then you would want to keep them in or resuture and keep those sutures in longer. So you want to pull up and cut and pull the suture out.